You're rightly saying we are in the age of where everybody wants a quick fix. You want a pill for everything. So this is where these painkillers and so-called non-steroidal NSAIDs come in. And unfortunately, because kidney and liver, by the time we know that they are affected, it sometimes is too late or the patients have too many problems.
When we can't sleep, when allergies strike, when pain lingers, we often reach for simple solutions. But these solutions may come at a hidden cost, your brain. In this episode of Health Chronicles, we uncover how antihistamines, sleep aids, and even painkillers can lead to confusion, memory loss, and cognitive decline. Dr. Usman Aftab Ahmad, a respected neurologist, guides us through the evidence and what you need to know to protect your mind. As a general physician, you see patients using ibuprofen or naproxen for various pains. Beyond stomach ulcers, how do these drugs impact other systems like the heart or kidneys?
You're rightly saying we are in the age of where everybody wants a quick fix. You want a pill for everything. So this is where these painkillers and so-called non-steroidal NSAIDs come in. Apart from having problems with the GI tract, they have problems with the kidneys, they have problems with the liver, because everything gets metabolized either in the kidneys or the liver. And this is where we tend to see lots of problems. And unfortunately, because kidney and liver, by the time we know that they are affected, it sometimes is too late or the patients have too many problems.
What red flags should patients watch for when using NSAIDs for chronic pain?
So the red flag signs, the simple ones are gastritis or pains in your tummy, which is the upper part of the tummy. Dangerous features would obviously be vomiting and vomiting with blood. But more significantly, like we spoke earlier about livers and kidneys, if you start seeing jaundice, which is the yellow coloration in your eyes, or you start seeing any change in pattern of your urine, like the color is changing or the frequency is changing, or you start seeing blood. These are the red flag signs you should be looking out for.
Many patients combine OTC cold medications, for example, pseudoephedrine with painkillers. What are the most dangerous interactions you've encountered in general practice?
The problem with over-the-counter medication is whenever you go to a doctor or you are speaking to a clinician or even the pharmacist, you tend to forget these over-the-counter medications. So these do have interactions. A lot of the time, the medication that you are on, which is prescribed by either the doctor or dispensed by the pharmacist, they already have the same chemicals that are there in over-the-counter medications. I can tell you hundreds and hundreds of examples, but let me just gross you out and tell you something very serious. So I remember seeing a patient who came to us with upper GI bleeding, which is bleeding through the mouth. The problem was because the patient had collapses. So the patient did not know what was actually happening. So they saw a cardiologist, endocrinologist, a general physician, everybody for their collapses. And on deep history, it found out that they were having black stools, which we in technical term call melena. This is where we got involved. And we did an endoscopy and the patient had a bleeding ulcer, which required a prolonged hospital stay, needed an intervention, invasive procedure like an endoscopy, and then procedures through it, which not only affects their general well-being, it also has a lot of pressure on their purse, on their pockets. And this is regardless of saying that they need to stay in hospital for a very long time.
Why are elderly patients particularly vulnerable to OTC drug side effects?
One thing we should know about when we say elderly people, basically what we are, I think I might be geriatric very soon as well, so this is a soft spot for me. With the patients with advanced age, what they're happening is, you can imagine that all the organs are slightly older than when they were young. Number two, they are already on some medications, whether they can be continuous or they can be in small courses or doses. Then, of course, because they're taking a lot of other medications and they might be in a phase that their is a start of underlying medical problems that are not evident now. So when you start taking these over-the-counter medications, these medications start putting more pressure on their kidneys, on their skin, on their brain, on the liver, and of course my specialty, the gastrointestinal tract. Now, because of all these factors and the medication that they are already taking, the effects of over-the-counter medications is doubled, sometimes trebled, which can cause to bleeding, which can cause to worsening of their kidney disease, worsening of their liver disease. It can cause bruising even in some cases, and patients, unfortunately, because with advanced age, they can't remember all of the time how much medication and what frequency they are taking it. So the chances of overdosing these medications is higher.
How do everyday supplements like calcium carbonate or antacids with magnesium, aluminum harm patients with undiagnosed chronic conditions?
So this is a very touchy subject. I think a lot of doctors and across the fraternity will tell us that this endemic of using medications when you've got to certain age. The problem is we start taking multivitamins, we start taking these magnesium supplements, we start taking zinc and all the other health supplements only because we've got to a certain age. Now, if you go through all the international consensus guidelines about medical problems, you will see any medical condition or new symptom that happens after 45 or 50, we can't just ignore it. You can't just do a patch-up job. If there's a crack in the wall, you keep on painting it, the crack will come back again and again and again. So what happens is, when you start taking, well, let's say I'll talk about my specialty. If somebody starts having dyspepsia or acid problems or burning or pain in the upper belly, the first response is going to be, let's start taking these supplements like aluminum based or these antacids, so far they are called. They will do a certain job, obviously. Now the worst thing they can do is mask the symptoms. Because if you are a non-medical or health-related personnel, you might say this effect or the short-term benefit, I'm fixed. Unfortunately, because they might be masking some red flag signs, so you get benefit for, let's say, a day. A lot of people come to us and say, "Gee, we took the medication, I'm happy for 2 days, and then we have to take these medications again." Any medical problem that is new after the age of 50, or what it is doing is it's causing recurrent symptoms as soon as you stop. This is where you need to think to yourself that I need to take a time off and speak to a proper physician.
What advice do you give patients who self-medicate with OTC products instead of seeking a diagnosis?
Over-the-counter medications do have their place. In Western world, there is very limited over-the-counter medication that you can take. I can tell you, me being a doctor, when I go to a shop in England and I start buying ibuprofens or paracetamol-based things or any aspirin-based stuff, these things, even the normal shopkeeper will stop me, not the pharmacist, a normal shopkeeper. It will ping on my basket and I won't be able to buy it. This is, you can try it on websites like Amazon. It won't let you buy more than a certain amount. My advice would be, please, if you are having to use over-the-counter medication repeatedly and recurrently, then even if you don't have time to speak to a doctor, which you should, somebody like me, or you speak to a pharmacist who's locally available, because they can tell you about what side effects can happen, what medication not to mix. I think that's the most important thing. Do not mix over-the-counter medications with the medication that is prescribed for you.
Your brain is your most precious resource, and yet it's the one most vulnerable to quiet, gradual harm. Before you take that next pill for sleep, for pain, for allergies, ask, what's it doing to my mind? Stay alert, stay informed, and stay with us at Health Chronicles on OHealth TV, where clarity begins with care.